Hello, guys. I hope you all are doing good in your life, in your studies, everywhere. You are keeping yourself happy. So always keep that smile on your face. So let us learn quickly about adsorbents, one of the treatment modalities of a poisoning case, which we read in general toxicology and general management of a poisoning case. So after doing gastric lavage, which removes unabsorbed poison, what is recommended is you can give adsorbents to a patient. Adsorbents are agents which will bind to a toxin and help in their excretion. Important examples being activated charcoal, black color tablets of activated charcoal come in the market. Then we have yellow color Fuller's Earth tablet. Fuller's Earth is nothing but multani mitti. Okay, so इसके भी tablets आते हैं market में. So activated charcoal tablets and Fuller's Earth tablet, they act as adsorbent, can be used in many poisoning event except few contraindications. So what are the situations where they are not recommended? So let us learn those things. The list is very small. The simple mnemonic being corrosive lime. So it is not indicated for corrosive poisoning like acids and alkalis. And the lime to be remembered as LIME in a sequence. L for lithium, I for iron, M for metallic poisons and methanol, E for ethanol and ethylene glycol. So what are the important contraindications? Corrosive lime. Corrosives, L for lithium, I for iron, M for metallic methanol, E for ethanol and ethylene glycol. Stay tuned for more such updates. Bye-bye.